I'd like to call the August 31st, 2020 meeting of the Health Committee to order. It's actually our September meeting because of the way things fall. We're having it in August. We have all members present, so we have a quorum. And we have minutes to approve from July 21st of our stand-up meeting and August 3rd of our regular meeting. Do I have a motion? Motion by Robustelli, second by Chung. Are there any additions or corrections? If none, I think Ms. Morlock, can you call the roll, please?
Yes, please. Member Robustelli.
Yes.
Member Gordon.
Yes.
Member Wendt.
Yes.
Member Martin.
Yes.
Member Metzger.
Yes.
Member Chung.
Yes.
Chairman Schaefer, will you be voting?
Yes, and yes.
Thank you.
Okay, the minutes are approved. Do we have any members of the public for appearance?
We do not, Chairman Schaefer.
Thank you. We'll go on to Departmental Matters. First up is Jessica McKnight, the Health Department Administrator. And you have an item for action, which is request approval of a resolution amending the funded full-time equivalent positions resolution for 2020 Fund 112 Health Department. Is there a motion to get this? Motion by Robustelli, second by Chung. And Ms. McKnight, did you want to say anything about this, or we have a memo here from you?
Yeah, were there any questions about the memo?
Member Metzger.
Yes. You indicate that the grant will pay for the funding for this position. So is this, I mean, I'm hoping that COVID doesn't last forever. And so, and I would assume that this grant is not something that we would have for years and years. And so is this going to be temporary? I mean, obviously it's not temporary if you're looking at IMRF and various other things. So can you help me understand the longevity of this and where this is going, please?
Sure. And so we did have a 0.4 FTE communication specialist. And so we're looking really to put a full FTE health promotion specialist. And so the salary decrease will allow us more flexibility in our budget. And it is something that we're looking at to take after COVID as well to keep on board. So I'm looking right now at the budget, and we should be good for fiscal year 21.
What, I mean, I'm assuming we don't hire people temporarily for a 2-year period. So what is the plan after 21?
I'm not sure. I'd have to relook at the budget every year, reassess the positions that we have.
So when we do that, do we communicate that to the candidates?
Yes. So, I mean, all of our positions are based on grant funding or the tax money. And so that can change yearly. And so we would definitely communicate that to our candidates upon hire.
Okay, very good. Thank you.
Member Robustelli.
Ms. McKnight, how many full-time equivalent positions do you currently have that are dedicated to communication with the public in this way?
In this way, we would have, I would say it's probably 3 FTE, but I have to check the exact number because some of them serve different roles. So our health promotion specialists, we have currently 3 FTE, but we're looking to add a 4th.
Yeah, I just want to say, I asked that question because I think one of the things that we've learned from this is just how important communication is in these moments of crisis, and that you can't quickly go out and hire somebody who understands the agency, understands the programs, understands community, has the community networks that they need. And so if anything, I don't know if this has been done or needs to be done, but I hope that this is adequate. If it's not adequate, I hope you will come and tell us what is adequate with regard to communication, because while this we hope is incremental and isn't something we need to do forever, we're certainly going to have to continue to keep our foot on the pedal with regard to public information to our constituents. And so if this does that, that's great. But I hope that you will come to us and say, no, actually, proactively, we're going to need more temporary people, more on contract people, more something, so that our constituents fully have all of the resources, information that is available. Because otherwise, we have it's all rumor mill, it's all social media, it's all things that don't really move the ball in terms of good public health practices. So I just want to encourage you to be proactive when it comes to staffing needs in communication in that space, because we desperately need to do the best job we can do, and that means people, and you have to do that sooner rather than later, I understand. So I enthusiastically support this proposal. I just hope it's enough, and if it's not, I hope you'll come back and tell us that.
Any other questions? Okay, Ms. Morlock, would you please call the roll?
Yes, ma'am. Will you be voting on this, Chairman Schaefer?
I will be. I keep forgetting to tell you that.
That's okay. Member Robicelli,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Chairman Schaefer.
Yes.
Carries.
Okay. Then you also have your report, and I don't know if you'd like to talk about anything, given a lot of the events in the last week, even considering, what has happened in the last month. So I'll just kind of give it to you first to highlight anything you'd like to highlight.
Sure. So we have hired 10 contact tracers that are on board last week. So they've been trained, and we interviewed individuals last week, 17, to hopefully bring on an additional 10 in the next week or two. And then we're still gathering applications to bring on an additional 10 contact tracers. So the initial forecast that CDC had out was that according to our population size, we would need roughly 35 to 40. So we were shooting for 30. And, obviously the numbers that we're seeing now show that we need more. So I'm also looking at the budget from the grant to see, is that a possibility for us to increase the number we're looking for? Also talking a lot with IDPH about what's available to us. Initially, the IDPH was going to hire the candidates for contact tracing and then make them regionally available to local public health agencies before this grant became available. So that kind of puts into perspective why we're a little bit behind, is initially anticipating that these positions would be filled by IDPH. And so a little bit of update on that is that they're still going forward with that. And so they're, I think, hopeful that by October, they'll also have this surge capacity availability to health departments as well, because we're in the same position as many of our comrades across the state are and nation, is we've got more than we can handle for contact tracing and case investigation.
Okay, Member Robicelli.
Ms. McKnight, first, I just want to say, and please pass it along to you, to your staff as well. I want to say thank you to everybody. It's a Herculean task that you've been given. It's nearly impossible, and it's incredibly difficult. And so I've been reading a lot about burnout with public health professionals across the country, working many, many hours, not having the resources, all those things. And so I just want to say thank you for the service you're providing and all the hard work that you're doing. I think it's fair to say that there is a considerable amount of concern with regard to the resources that we have available to mitigate the spread of COVID in McLean County. And you've been very transparent and open in media interviews about the, and just now with regard to not having the contact tracing program up and going. And I think it's worth just reiterating that it sounded to me like one of the reasons it wasn't where it needed to be was there was a thought that IDPH was going to do some hiring, and they didn't. I guess I would just say, from my perspective, for what it's worth, is the normal chain of the way this is supposed to work. The federal government leads, the state government leads, and then we sort of work from there. I think we're going to need to change that orientation. I think we're going to need to think about where there are areas of opportunities to build out capacity. We're going to need to take the lead. We're going to need to put resources into building infrastructure that give us a chance at being successful. So, for example, I've had a really hard time explaining to constituents how it is that our contact tracing program doesn't quite meet the CDC standards in anticipation of 20,000 plus students that came into our community. I can't explain that. And so part of the explanation is what you just said. IDPH was supposed to hire people, they didn't. But I would just say, I think across the last 4 months, this in a bipartisan way, I think there are members of the board who have said, if the health department needs resources to help us keep the economy open and to keep people safe, please come back to us and ask for them. Ask for whatever that is. That's what a rainy day reserve fund is for. This is not a rainy day. This is a monsoon. So let's spend the resources, if we have to in the short term, to not get put into a position where we're not able to do some of the things that we can do. So I just want to reiterate again that I really hope that we can find some space to be more proactive when it comes to resourcing for mitigation, and not wait or hope that the state or federal government is going to come in and do it, because they just don't seem to be doing it. And then we end up now, if I understand your math correctly, we are less than a third of where we need to be in terms of contact tracers, because there's 10 you just hired. We're going to hire 10 more in the next 2 weeks, and then 10 more over the next 3 to 4 weeks, and we need 35 to 40. So, and in the meantime, we have all our students here, and things are spiking across the community. And that doesn't even account for what people are saying is going to be the second wave that comes in November, late October and November. So, I just make that broad statement just to say that I hope we aren't sitting back and limiting what action we take because of resources. If resources would fix this, I hope we can have an open discussion about what that looks like and put resource into mitigation strategies like a robust contact tracing program. So I don't know if any of that, I would like to hear more from you, just to learn more about, by September 30th, if it was a perfect world, and you had unlimited resources, what would that look like? What are things that you need? What should we be talking about?
Yeah, so this is the exact conversation I had with IDPH today of what do we need? What would it take? And so part of what we need and what it would take, there are things that we're looking at is how do we increase testing in the community, especially on campus, because that's something that needs to happen. And I know that for ways to do that. So talking with IDPH about how can we assist in that process. And then the sheer volume of positive cases that we've seen in the last 2 or 3 weeks has been just beyond manageable. We would need between 70, 80, 90 individuals to help us at this moment. So what we really need is to go upstream. And what I think that our communities are trying to do is put measures in place that are beyond what the health department has the capacity to do, to put enforcement measures in place to prevent us from seeing further spread and outbreaks. Because by the time that anyone is able to get a hold of a contact, let alone a case, then their contacts have already potentially become infected someone else. So there's so many different pieces of this. Part of it is, those enforcement pieces that are beyond us. Part of it's testing, and then what we're already doing in increasing our capacity with contact tracing. So again, we're definitely looking to go beyond 30 if we're able.
So when you say beyond 30, if you're able, I mean, you've mentioned 70 is sort of what we would need at this level. I imagine, and I've read that you're partnering with the universities to build up their capacity. So I don't know. I don't know what the committee thinks, but I do know this: there is no way we will be able to sustain locally a failed contact tracing program for much longer. And I think it's fair to characterize our contact tracing program at this point as failed. It's not connecting with positives, and that means communities were relying on people to voluntarily distance themselves and report to their friends that they have been infected. So if we want to keep the local economy open and we want to keep people safe and minimize the healthcare impact this could have, I think we're going to need to invest in the short term in more contact tracers. So I would love to have a conversation about appropriating those funds to do that. I think that's a smart thing to do. So I don't know what others think, but I hope that we can have that conversation soon.
Can I interject in here, please? And I'd like Jessica to address this issue when you're talking about this kind of thing, about being proactive, and what you were talking about, Member Robustelli, about how the state determines a lot of this stuff as to what we are to do. And yes, now they have some guidelines in place, but to be proactive prior to this, prior to, they're changing the rules all the time. Ms. McKnight, could you address that a little bit, please?
So really, with a pandemic and a new virus, the whole response to COVID-19 has been a lot of pivoting. And as we learn new information from IDPH, as they learn from CDC, as they learn from WHO. So IDPH is the body that we report to in terms of guidance, guidelines, recommendations, and they in turn report to CDC and get that information from them. So I don't know if that's what Member Schaefer was looking for, or something different.
It was more along the lines of contact tracing to you just can't hire anybody on contact tracing, and what, this it's not that some of our qualifications as an employee, but it's some other qualifications that we have no control over. So that then impacts some of our abilities to be certain ways, or to be even proactive in different ways. And that's kind of where.
Yeah, and it's a specialized skill. Sometimes it sounds like you can just show up and answer a phone, and it does go beyond that, because we want this to really do what it is intended to do and help us control the spread. So I mean, as we're looking at individuals that we're hiring, we're looking at that week of training, that week of observation with our disease investigation specialists, so that they are ready to go and really can help us with this, because it is a specialized skill. We're also running into some individuals where we're having problems getting candidates, which I know my other counties around us are in the same situation, where it's not something that you can do just a couple hours a day, a couple days a week. It's something that we need individuals to be able to commit to, 4 to 5 hours a day, really 7 days a week, because we're not stopping this on Saturdays and Sundays. You have to follow up with someone throughout their entire isolation or quarantine. So not everybody's really on board for that type of job, and that's what we're looking for.
Thank you. Member Wendt?
Now, it's my understanding that you have substantial reserves, that it's not a money problem. It sounds to me like it's a problem getting enough people to do it that are qualified to do the tracing. And if it's money, we should know about it. But it was my understanding that the health department had substantial reserves that they could use for this purpose. And it sounds to me like you're just having a hard time finding enough people to hire, which seems to be strange with people off work. But enlighten me on that, whether you've got enough money or is it a problem finding the right people to do the tracing?
No, I definitely agree with our board and with the board members about, what do we need and what we want to look forward and get in place, knowing that we do have those reserves. So the money is not as big of an issue as, like you're saying, finding qualified candidates who are available now and are able to commit to what we need them to do.
And getting them trained, and the training takes time.
Yeah, so basically,
Remember,
what we can do right now is just trying to find enough people out there that are willing to do it and qualified to do it. You'll come back to us if it's a money problem, and we can work with that. But obviously, you should use what reserves you have. That's why you build reserves for emergencies, and this seems to be an emergency. So hopefully you can find enough people out here to do the proper tracing. And I know from what I've heard is that it's very difficult trying to get some people hired now. I've been talking to some contractors, and they're having a hard time getting people back to work. And it sounds like other counties in this tracing thing are having the same thing. And like I said, if it's a money problem, get back to us. But it's my understanding is you've got the reserves to do it for now, and hopefully you can find enough people to do the proper thing for this. So thank you very much.
Member Martin.
Thank you, Chairman. Jessica, I'm not sure you can answer this question, but I'm just kind of throwing it out to try to find information. I know we have a lot of positive tests, and I know that we only have 3 to 4 that are hospitalized. Do you have any idea how many of those people who have quarantined or who are tested positive who are actually sick?
I don't off the top of my head. I can look into it. I know that the last data I had for asymptomatic was about 10%, but that doesn't answer how many are ill. And what we're also seeing is very, very mild symptoms. And anecdotally, lots of individuals saying, I thought it was just allergies. So we are seeing a lot of mild symptoms. And like you said, 4 hospitalized currently, 1 in ICU, but I can definitely get you more statistics. We went to a new system in the last 2 weeks for contact tracing case investigation. So pulling reports that the data that we need and want is proving a little challenging.
All right, thank you.
Member Chung.
Thank you, Madam Chairman. I echo a lot of Member Rostelli's sort of comments about, I guess how contact tracing is kind of a mess right now, and not having the proper people that we need to do this. Now, I guess I have a couple questions. Is that how many people were, I guess, already hired on as contact tracers before these 10 were just hired? And then the other question is, I think last month we had talked about ISU having contact tracers, or are these people that are hired, are any of them going to be just, I guess, dedicated to the university? Because it seems like, a bunch of them will be needed to be just dedicated to what's going on over there.
So 5 to 7, and we're probably going to look at 7, can be solely dedicated to ISU. So we've been working on a partnership with them to have them on campus, and they're going to work with Student Health Services. And then Student Health Services, they've been working with the Mennonite College of Nursing to also cover right now and train up their staff and work with us. So they've been covering some case investigation, contact tracing as well. Internally, we have 6 staff that's part of their daily routine is to do contact tracing for other infectious diseases. And then we trained up At first, it's changed in the last couple of weeks because we've trained up additional staff. We are at probably 10 to 14 that we have trained up internally to help us, especially right now as we bring on the contact tracers through the grant. So that, I was trying to do math in earlier in my media. So that's probably, we're at 6 and 10, 16, 17, 18, probably close to 20 internal. And then we brought on the 10.
Thank you. And thank you again for a lot of that information about how, you know, the IDPH and hiring the tracers. It's proved very helpful for me as I've gotten many sort of emails and questions from constituents recently as to why contact tracing is not happening in the capacity it should be. So thank you for all of that. That's very helpful.
Member Robustelli.
So I want to follow up on resources because I think it's important to understand what I was saying and what I think is a lot of the tension in the community. And that is, I believe, if I'm not mistaken, correct me if I'm wrong, that our hiring of contact tracers has been through the timeline of the grant we received. We're not using local money to hire contact tracers. And so, but in early June, you had developed a project management outline that said very clearly we needed to hire contact tracers. And we allowed a grant cycle to determine when we posted the positions and when we hired for them. And I guess what I'm saying is we have to be more proactive than that. Like if we need 35 contact tracers before the universities open, then we should have started posting for those positions, use local money, and when the grant money comes in, we transfer it over if we need to do that. So this was not a case of, I mean, I do very much appreciate what Chair Schaefer has said about the moving of the goalposts, the different information we get. Contact tracing is actually one that I think has been pretty consistent in terms of the need for it, especially in university communities. And as you said, the CDC has outlined for a community our size an approximate number. And so I just hope that whatever we need, regardless of grant cycles, regardless of state and federal money, you will come to us with an appropriation if it needs it to try to hire that number of contact tracers, because otherwise we are going to fail to mitigate COVID-19. So that was the context. If anything I said was inaccurate, please correct it, because I would really like to know so I understand you know, the nuances of the challenges we face. Ms. McKnight.
Yeah, I think you're right on with the timeline. It was June when we found out, I think June, we found out about the grant funding. So writing all the positions, getting them approved through county, going through all of our budget appropriations. So, you know, it takes a little time, but writing contracts and deciding if they were going to be contractual versus FTEs. So, you know, it was right on with the grant cycle, even if we had used money out of our budget.
I have a question because we're kind of on contact tracing topic. So there have been numerous establishments in the community that have closed because they've had numerous employees test positive. And so when there's one of those places that is serving many people in a very close proximity, basically we're talking, because you have said in your thing is a lot of the bars and large gatherings is the cause of a lot of the increase in this. And so how would you contact trace if you found out there were numerous employees that were positive when in an establishment where has hundreds of people going in and out in one evening? Can you explain how you do contact tracing for that kind of environment, and what kind of reception do you get from that population that you're trying to contact?
Yeah, and that might be one of those instances where we would have to go out into the public, or I think a lot of our businesses are doing that, and going out through the media, social media, whatever way it is, that announcing to the public there's potential exposure, because it's nearly impossible to identify close contacts when in those instances where you may not even know the people that are around you. So, I mean, though that's what we could do is go out through the media and say that on this day, if you were at this location on this date at this time, please monitor yourself for symptoms. And that's really about the best you can do if you cannot identify any close contacts.
Thank you. Member Wendt?
Yeah, now there was a report out, and I don't know if it was McLean County, where there was a lot of false positive. Was it in McLean County that the testing resulted in a bunch of false positives?
I'm not aware of that. The PCR test is the gold standard. So more often than not, you're going to have a false negative than you're going to have a false positive.
Yeah, I had just heard on the radio, and I thought it was in regards to something here in McLean County, is that there was a batch of false positives. And now what you said about obviously a restaurant or a bar or something that has some employees that are test positive, you can put out in public is that if you've been at such and such bar or a restaurant or what, you should go get tested for it, which doesn't mean you're going to get sick, because there's a lot of people that test positive and don't ever get sick. So, but anyway, that's, I would assume the way you would trace that is that there's no way you could trace all the clients that came in and out of a restaurant or a bar or Walmart or Menards or anyway.
Yeah, those retail stores or bigger stores, it's a pretty low risk situation. Exposure, a bar would be a higher risk. So you may not need to go out to the public in the case of a Walmart or a Menards or a store where the interaction is very, very quick, not over 15 minutes, probably not very close quarters. But yeah, a bar is something where it's potentially very close and no face coverings worn. So yeah.
Member Chung?
I guess this is not really about contact tracing right now. But I would like to, if Ms. McKnight could kind of explain, because I've seen a lot of questions about this, and people have tried to explain it online about the lag time of the ISU numbers and versus the numbers that we get for the county. If you could explain that some more, that would be really helpful. Thank you.
Sure. So the labs that we get reported to us in the system are coming from all over. So private labs, the state lab. And so they could come in depending on when that lab is able to process. It could be 2 days since that specimen was collected, 24, 48 hours. There's all different time periods. And so ISU is reporting numbers that they are getting when they're getting them. So they have their own contract with a lab and a portal where they can go on and see, as soon as they are up, those results, what their numbers are. Then it will take some time for those to get reported to us into our system. The Salesforce system only, right now, they're working on improving this, but only dumps data, I think 2 or 3 times a day. So it could take a day where, if we get labs dumped in later in the day, we may not get them until the next day reported. So that's a little bit, hopefully that clarifies it a little bit, but it's very complex because they're coming from all different labs and they may be reported by that lab before they're reported to us through the state system.
And I guess, so the ISU numbers are, so you're saying it's just done through their testing, like on campus. So this doesn't count for, I don't know if there's any ISU students out there who are actually going to the Interstate Center, but it's not counting them then as part of the ISU numbers then, right?
Correct.
Okay.
Yeah,
Thank
and
you.
so it's difficult because we go by addresses. So it may even be difficult for us to determine they're an ISU student if the address is off campus.
Okay, thank you so much.
Member Robustelli?
You mentioned high risk areas and bars, those kinds of things. And I think we've seen especially the first weekend that the students came back, some of the bars in particular, throughout the community were really way pushing the capacity limits that were in place. So I just wonder, and you also mentioned that there are certain things that the health department doesn't have jurisdiction over, or maybe doesn't have the authority to do. Can you walk me through how you will be approaching, and the Board of Health will approach, making formal recommendations to our municipal partners? Because what I keep hearing from them is we're relying heavily on our health department and those people that have specialization in this. And so if I got a recommendation, I would take some kind of action. What's the threshold for you where you will, put together some best practices? I mean, it just seems like, again, if we're waiting for the state or federal government, it's not going to happen. But there are some things that I could imagine us asking municipalities to do that we know would help limit contact. For example, reservations in bars and restaurants. Then you would know every person that came in. You wouldn't have to do the public broad announcement, anybody who went to a restaurant on Tuesday, because if every restaurant was required to do reservations, then they would have a name attached to their reservation. And we'd go to them and say, here are the hours, or new capacity signs on their front door. Other communities are doing this where they just say, well, you're allowed 25% capacity, you're allowed 80 people or 20 people or whatever the size is. And then customers would know, are they breaking the rules? Should I go in there? And they can be informed. So I just wonder, is it just, are you going to get to a point where you're going to make those recommendations, or that's just not something that you will do?
You want me to answer that?
Sure.
So my name's Chris Spano. Some of you I've met already, some of you have not. Mr. Robustelli, I'd like to take just a minute to answer your question, at least from a legal standpoint. While the perception may be that Ms. McKnight has the authority to do many of the things that you just suggested, she does not. And while, tilt it up, you don't want to look at my chest any longer. I think that down. So we have met recently with the mayors of both the city and the town of Normal. We have met with both of the administrators, the president of ISU, president of Illinois Wesleyan. We were all present, and we spent quite a bit of time talking about the authorities that Ms. McKnight has. And right now, for the most part, under her authority is to make recommendations, but not to order anything closed. So for instance, she could, we're having some issues with a couple of the sororities, a couple of the Greek houses. And we were considering today, and I'm actually working on it, multitasking, of course, I'm listening to every word you have to say. But there's a couple houses that may be necessary to put an order on them, to do something with them. And we're in the process of looking at exactly what might be called for. But as far as like shutting down a single sorority house, she may have the authority to do that under the appropriate circumstances. And that's what we're looking at right now, if those circumstances fall within that authority. But as far as telling the whole town of Normal to wear a mask, she can't do that. That's not for her to do. It would be for the city of Normal or for the city of Bloomington or each of those individual municipalities to make that decision themselves. And so from Jessica's standpoint, to answer your question, she may make recommendations based on things that are coming down right now, but unless there's a specific individual situation, so we could trace it all back to one bar where there was an outbreak at one bar, she may be able to do that, but she can't issue any sort of edict that require all patrons to wear a mask until they're waited on or not be served until they sit down. That has to come from a higher authority. I don't know if that answers your question. I hope that
that does. It's very helpful, and actually it's very in line with what I think is a good approach. I mean, I would rather, what I hear is from those in municipal government, we don't have any environmental health specialists. We don't have the expertise to come forward on our staff to say, you should do it. Here's a recommendation. We recommend that you close bars earlier with certain triggers, of course. I don't know what those are. And so even if just the health department could make those recommendations and was thinking about it in a proactive way, I think that could go a long way, knowing that they don't have the authority to take action, but they could certainly put in mitigation policies or recommend them that the cities in town could do that might reduce the amount of spread. And so that's really what I'm getting at is all I want is there a commitment to make recommendations when there needs to be to the municipal partners that we have, whether it's masking, whether it's reducing hours at certain types of business, whatever it is.
If I may, Member Robustelli and Chairman Schaefer, if I may speak, I most certainly have offered up Ms. McKnight's expertise to the town and the city. We have engaged in conversations with both of those city managers, the city and the town, and have even been available in answering specific questions of municipal leaders via email. So from those standpoints, we have always been and continue to be ready and willing to offer expertise in that arena.
And I think another part of the question was, what are those metrics? And I mean, we've hit them, we've surpassed them. So in terms of being proactive, we've started those conversations already, and we'll continue them and continue to share the strategies. IDPH has some mitigation strategies, and we will continue to share those with our municipalities.
Well, and I'd like to make a comment too about that whatever any municipality decides to do, whether we recommend it or not, it has to, number one, have an enforcement mechanism to enforce that. And number two, it has to mean something. And what you've seen in Normal, they have said there's going to be a fine of, I can't remember, $750. I can't remember what the number was that they put out there. So if Bloomington, wants to do that, they have to have something that's meaningful to people. You look at a lot of universities across the country that have been saying you're suspended, you're kicked out, you've got to go home, you can't even stay here. I don't know what, and I don't know how you do that with students that have leases, but the university has to decide what they want to do to try to mitigate it with their students, to get them to understand, and Wesleyan and is included, and so is Heartland and any of those institutions, as to understand the severity and the impact, not just on them, but on the entire community that they live in, and whether they live in a dorm or they live in an apartment. And so I think that those entities, those governmental bodies in different ways need to make sure that it's meaningful, instead of saying, well, you don't have enough contact tracers and we didn't, do it fast enough or whatever. If they believe that, then they need to do something to try to help mitigate it also, as we work through some of these processes. And that's just kind of like my opinion on that one. Anyone else? I mentioned to the committee that Ms. Wachynski, can't talk tonight, has asked to be a member that participate in this meeting, and apparently she does have some questions because they weren't all answered then today. So if the committee does not have any objection. Okay, Shana?
Thank you, Madam Chairman. Most of my questions were answered. But going back to the contact tracing, I know you said you were having trouble finding candidates. Can you tell me if there are there special qualifications that someone needs in order to be a contact tracer, like a degree or anything like that?
No, the biggest criteria that we're, the obstacle that we're running into is you need to, we want you to live in McLean County, because it's not something that can be done 100% remote, because there will be training. So you would need to ideally live locally, even if that's, a surrounding county. And really we're looking for, customer service experience helps because you're gonna be doing a lot of phone calls and a lot of, speaking with individuals who may not want to speak with you and hear what you want to say. So that's really what we're looking for, is an individual who's willing to work in our office for a little while. And again, the hours are things that, getting people to understand that it's not, contact tracing is not a 1 hour every 3 days. It's dedicated all week. So I need to be able to work every single day for several hours.
Okay. And I'm just a little shook, I guess the kids would say, that you're saying today that we need 70 contact tracers, at a minimum, and we have 20. So I think my suggestion, whether anybody wants it or not, would just, I feel like you need to be really direct and loud on that, because for me, coming out of this meeting, the headline is, we need 70 contact tracers, and we don't have them. We have, 10 that we just hired. And that's like, what are you doing to advertise that and get the word out of what you're looking for?
Well, in the 70 plus contact tracers that we would need, that's surge. So we're dealing with a surge right now. We've had several hundred cases in the last couple of days. So we would not always need 70 plus. And that's where, IDPH, where I'm reaching out to them to see what is available to us. They're looking to get that surge capacity that's available to local health departments as well. We've been advertising that these positions are available in Minigraph when I'm on the radio. I think it's on social media as well. So, and really community partners also reaching out to them and promoting this. So again, sometimes it's the schedule that individuals are not so hip on, potentially having to work on the weekends, because there is that potential, and that it cannot be solely done remotely right now.
Okay. And only one more question, I think. And I know I kind of had emailed you about this. A lot of people, we're getting a lot of community feedback. Obviously, everybody's a bit freaked out right now. But there have been concerns about people not quite understanding, or there not being an easy way or a clear way to report a business that they believe is not complying with COVID guidelines or restrictions. So I know I had talked to you about possibly, I don't know, a hotline or something like that people could call, but is there anything you can do, like a button on the website that would be right there that could say to report a business, click that button and take you straight to the environmental health form? I mean, people are having concerns, but, and then I guess we run into, if that happens, do we have the staff to even follow up on those things?
Staffing is obviously an issue. Our environmentalists are handling those complaints, but they're also tasked with ensuring food safety. So there's definitely, we've had an enormous influx of calls with complaints to follow up on. And it is on our main page of our website, a short little description about who to call. There's an email address and a phone number of where individuals can call to report complaints. We just want to make sure that they do understand that those secondhand hearsay complaints, we can't investigate. We need to know from someone who has actually witnessed the incident, so that we can actually follow up and follow that process, that we have not just hearsay, but direct knowledge of the issue. So yeah, we could look into making it a button or something that's on we've got a slider that's on there, because right now it's just right underneath the slider is where that's at.
Okay. All right. Thank you very much.
Member Chung?
Thank you. I guess this kind of goes back to what Member Rostelli was asking about, you know, making recommendations and things like this, because I just went back and looked. We've been at above 8% for almost a week now. And I know that 8% was this sort of magic number, right? The 8% sort of 7-day positivity rate. But nothing, almost nothing has really happened in this past week. And so I'm just wondering what else it would take for recommendations or things to be made. I know that the Town of Normal has done something, but part of me, I guess it just makes me feel like, I guess when people kind of see that nothing is happening, then maybe they should just keep on doing what they've been doing, even though we keep inching up. I mean, we're past now 10% for maybe 4 days now. I guess I don't know what it's going to take for something to happen, but it's headed towards a whole lot of not good, I think, the way we're at right now, and without any sort of, you know, strict recommendations or something, because I do, at least from what I understood, that this 8% thing, if it happened for 3 or 4 days in a row, that, you know, nothing, it wasn't that necessarily things were going to be triggered, but it was supposed to catch the attention of like local leaders. So my attention is here. So tell us what we need to do, I guess, or I would love something to be done. Thank you.
If I may, Member Chung and Chairman Schaefer, I was looking over at Ms. McKnight. What I'm about to say may not be very popular, but one of the most amazing things that Ms. McKnight has been saying since the beginning of this pandemic is that we should wear our face coverings and watch our distance and wash our hands. And I know that sounds like going back to the basics to solve this problem. I myself have young people, children that are of the age that are in this very high positivity rate that we are experiencing now. And I know that sometimes they listen to me and sometimes they don't. But right now, to stop community spread, you need the community to do their part. And part of that is contact tracing. Part of that is testing. And part of that, to me, which is what I'm saying is maybe not the popular thing, is the personal responsibility of each individual in this community to do what they need to do to stop the spread. Now definitely, Member Chung and Chairman Schaefer, that also includes leaders taking the steps to create ordinances or enforceable things that the community can feel. But I also know that when we think about what we know is occurring, when we see the pictures of the lines of young people outside of establishments without masks on waiting to get in, we all have to ask ourselves, what is the community together going to do to stop this? And I think it's all the pieces we've been talking about, but I would like to just insert that part of this is the individual's responsibility to not participate in large gatherings and to not go out and about without their mask on. It's hard to tell a young person that. I was in college once. I don't think I would have liked to have been told that I couldn't socialize when I was in college and that I'd have to live in a room alone when I'm a freshman, when I was looking forward to having a roommate. All of those things that make for the undergraduate experience are different right now. But I'm sorry I took up so much time with this, but I've been listening intently, and I think this is the one piece of the conversation that is part of the key. All of the other parts are a key as well. But I don't know if contact tracing has necessarily failed as much as everyone hasn't done their part to not gather in large gatherings. And I realize that's not popular, but it's hard for me to know that our communicable disease staff are working 12 hours a day, 7 days a week now during this entire pandemic, and that they might be listening to this and that we think that they have failed. And I think we all have a part in this. And I'm sorry I took so long to do something a little bit, perhaps not a part of my role, but I don't take it lightly. I could have been the health department administrator here answering your questions too. And I think that that's something that we should possibly consider. And that's part and parcel of why Ms. McKnight has come forward to say, I need a health promotion specialist. I need additional staff to do the communicating. That's part and parcel. But I just wanted to share that because it's been part of the conversation with our community leaders and that Ms. McKnight has been trying to promote this whole time. Thank you. I'm sorry.
Okay, Member Robusto.
So, first off, as you know, Administrator Rodriguez, I hope you always feel free to provide your professional opinion. It's very important that we hear from you. I think where I disagree with you in this particular case, respectfully, is we have done, I think every single member of this board and all of our staff have been talking about the personal responsibility component actively, proactively in every channel that we can, on our social media pages, with our friends, talking about it. We've done everything we can on that front. We don't have control over that any more than public relations, just talking with people, reminding them to use good judgment, to respect their friends and family, to do the right thing, as you say. All we can control is what infrastructure is in place and when it will be in place to try to give ourselves the best chance that we have at mitigating the spread of a highly contagious virus that is novel. We've never experienced this before. So this, for me, that's where I'm approaching this. It's not any one person failed. It's not any unit failed. It is okay, we have lost control of the spread of COVID-19 in McLean County. Our contact tracers are not in place. When you have hundreds of cases a day, and you have on average 10 to 20 calls per person, you do the math. You can't do it. I know that. I don't even need to ask. So when that's happening, and you look at when that's happened to other places, that's what I was referring to as the contact tracing program failing. It wasn't the individuals. They're working incredibly hard. It was, we're not reaching enough people to inform them and educate them that they have to do certain things, the personal responsibility, the reminders, all those things. And if you don't do that, it doesn't normally end up that the virus mitigates itself. So that's the way I've approached it. And I hope the staff know that. Like, I started out this, at least for my part, with an acknowledgement that public health, first off, they've never been more important than they are now, and they've never been given the acknowledgement of how important they are on a regular basis. Now, all of a sudden, in the global pandemic, teachers, public health professionals, these folks are more important than they ever have been. They always have been important, by the way, and have always worked really hard. But I do think we need to have an honest conversation about, we are on our own. We don't have the state. If we let the state dictate when we do certain things, we will not end up doing some of the things quick enough, or we may not be able to pivot. And so if we need to change internal hiring practices, we will have to do things differently than we have done before. And this committee has had those discussions over the last few months because we are in new territory. And so that was really that's the spirit for which I've approached this conversation. And I just want to leave it with that. I hope we can have honest conversation with the Board of Health and with our health department director and with our county administrator to say, please come to us proactively with ideas and recommendations. Even if it's not in our purview, we can try to, we'll support it with the municipal partners. We'll put in place the resources, whatever it takes, because that's what we can do. And then we have to also encourage people to be responsible and to wear masks.
Member Went, do you have something you want to say?
Oh, wait. If I can get my microphone on.
It's on, George.
I'm trying.
It's on.
It's on. It's on.
Hear you.
We can hear you.
Oh, can you hear me? Because it says my microphone's off. No, I was just going to say that the most important thing we just have to do is to make sure people like George and the other George and this George, be careful, because the death rate among people under age 65 is really awfully small, and even the hospitalization rate. And I know there was a report of a 52-year-old man that went to a family gathering and got the virus, and they were promoting that nationwide. My daughter, who works in a hospital down in Georgia, looked into it. They were promoting the fact this guy didn't have any underlying health problems. It turned out he weighed 500 pounds. And then there was another one, a little 5-year-old that died from, they said, the virus. They died in a bathtub. His mother, he was getting a fever, and his mother was trying to get his fever down by putting him in a bathtub, and he drowned. But that counted as a virus death. Well, it was a drowning. So I think the thing that we have to just promote is the people that are vulnerable, that have any health problems, be careful. And anybody that's over age 65 probably should be careful, even if they're real healthy. So I think if we promote that, and with the tracing and stuff that we're doing, we'll be okay in this county, even though I think what we've had, the last time I heard, we had 15 deaths, 11 of them were from the nursing home. So it's not that we shouldn't be vigilant, but I think we ought not to go overboard either. So thank you very much.
Member Chung.
Respectfully, I think that you should also, if you're talking about being careful and not going overboard, you should maybe also not go to gigantic gatherings of people without masks on. I'm just going to say that and put that out there, because I think you were somewhere the other day without a mask on, and other people were there without masks on. So if you were to tell us to be careful and to take care of you, you might as well not put yourself in those situations as well. Thank you.
Okay, Member Gordon, since you have not spoken yet, I will allow you to speak.
Thank you, Madam Chairman. The other George wants to weigh in. Number one is correct about the most vulnerable populations being very careful. My take on what's happening in the middle of not only a vast pandemic, but a vast set of unknowns about the pandemic, about the virus. My take is that everybody is vulnerable. And it is not only the people over 65 who need to be most careful. And the question of community spread, to me, suggests strongly that we need to take a community-wide approach. And this is the sort of thing that we have been talking about. The resources are already stretched. My concern about the numbers jumping the way they have is that the capacity to respond and to mitigate, that capacity is going to be stretched even further. And I'm afraid I agree with Member Robustelli that we may either be close to losing control, or we already have lost control of the virus. It is terribly troubling to me that so many young people, high school and college, and people in their 30s and 40s, the spread is especially noticed, obviously, is notable among people under 30. But when I read in the paper about infants who are testing positive, it's all over the age ranges. Yes, there are concentrations, obviously, in certain demographics, and certain demographics are more vulnerable than others overall. But individuals in every age range can be very vulnerable, and there's an awful lot that we are just starting to learn about long-term impacts. Someone can be asymptomatic and can end up with lifetime problems. And I've read about some of those cases too. Not that they've spent their lifetimes yet, but the point is that vulnerability is kind of a tricky term. There's more vulnerability, greater vulnerability, there's lesser vulnerability. but the impacts are things about which we still do not know as much as we will know. And I'm afraid that we're going to find out about some of those the hard way. So everything that Mr. Wendt, that member Wendt referred to, I can sign on to, but I think it's a much bigger challenge, and there are so many unknowns that we really need to be ready to respond to those and take advantage of every piece of information once it's verified that'll help us cope immediately and down the road.
Thank you. I think at this point, I'm going to end this conversation. I think that we could probably go on for hours and probably days on this topic. And I think we need to just move on through our agenda because we're all going to have our own opinions on this. So next up is the Adult and Juvenile Detention Centers reports. Shelley and Jason, they have their general reports. First, I'd like to congratulate Shelley on her pending retirement. And I think
you.
Your last day today?
Friday.
Friday. Okay. So if you, either one of you want to mention anything, any highlights or report or have any comments to talk about?
I have nothing.
I don't have anything either. I'd be happy to answer any questions.
Are there any questions? Member Gordon.
Thank you, Madam Chairman. I have some questions about some statistics, mainly statistics that I'd like to see more of, if I may. I understand that in the detention facility numbers, there are reports of the number of COVID tests performed. For the Juvenile Detention Center, I don't believe those numbers are present. And I would like to see those numbers included. I'd like to see us start to include those numbers in the monthly reports, as well as the numbers of hospitalizations and isolations in both the detention facility and the JDC. Would that be possible? Because with monthly running totals, we'll have a fuller picture of the situation in both detention facilities.
Yeah, we currently have not tested anyone, but we can include that. I have a feeling it will get to the point where we need to do that. We haven't had anybody with signs or symptoms, so we have not tested anyone yet.
And we've tested everybody 3 times. All of the inmates 3 times.
Well, if those numbers could start to be included in the monthly reports, I hope the need for it disappears much sooner than we think it will, but as long as the need is there, if we could see those statistics, it might be very helpful.
Absolutely.
Thank you. Appreciate that.
Are there any other questions? Member Robustelli.
Are there any current positive cases in the jail?
No, there are not.
Okay, and now that there are no current, I know that the sheriff had mentioned he was going to test every 5 days. So is that commenced? How are you doing the intake testing? Are we testing all of those that come in, or are we just doing symptomatic testing?
We don't test everybody coming in. They're screened, their temperatures are taken, they're moved into quarantine for 14 days. And if they have no signs or symptoms, then they are put into the general population.
Any other questions for either Shelley or Jason? Member Gordon.
Following up, once they are moved into the general population, they become part of the general testing protocols?
If we have a positive, then everybody is tested. And then they're tested everybody's tested every 5 days till there's no positive.
Would that cover then the possibility of asymptomatic cases?
Yes. And we also do test those that are going to prison within 72 hours of when they go.
Thank you.
You're welcome.
Any other questions for either Shelley or Jason? Like I said, congratulations on your retirement, Shelley. Enjoy it. Don't know what your plans were, but you're probably going to stay closer to home. So
Definitely, I'm going back to my little town. Thank you.
okay. Okay. Thank you. Moving on, next up is Terry Edens, the nursing home administrator.
Member Schaefer, or Chairman Schaefer, I'm sorry, she is here. She's coming to the podium.
Okay. Okay, thank you. You have an item for action is to request approval of recommended bid for a sprinkler system and electrical work at the McLean County Nursing Home, and that was emailed to all of you earlier today, the memo on that. Can I have a motion so we can discuss this? Motion by Chung, second by Martin. I guess that somebody might want to explain this a little bit more, because we do know that our CMS, I have it here somewhere, survey and inspection brought these to light, that even though they've been existing for how many years, as a problem at the nursing home. So I don't know if it's going to be Terry or Ms. Rodriguez to discuss this or whatever. So I'll let either one of you talk about that.
Well, I'll start, and if I need her help, I'll have her jump in.
Okay.
This is actually from a survey, and you can see by the memo that we had to get conducted some RFP for bids. It was a survey that was back in 2019 for the electrical and sprinkler system. Some of the things were antiquated and just need to be updated. Some need to be repaired. Some need to be replaced. So we did have 2 bids come in, and I don't know a lot about the statistics of all the bids, but or everything that they're going to do, but I do know it's very extensive. But they have it completed by the end of 2020, which is how long our waiver for the survey goes, till December 31st, and they guaranteed us that they'd have it done by then.
Okay, thank you. Are there any questions about this? Because what we have to do is we have to approve this and because we have the, since the nursing home is an enterprise fund and we have the budgetary oversight on that, so that property can then move on it on Thursday. So that is why we would like to get this approved this week. Member Metzger, do you have a question?
I just have a question regarding the amount of money will be coming from what budget then?
If I may, Member Metzger, it will come from the nursing home's budget from the enterprise fund.
Do you have another question? Go ahead.
No, it's all right.
Okay, any other questions, comments, or discussion on this? Okay, if none, yes, I will vote. Member, Ms. Morlock, please call the roll.
Ooh, I've been promoted. Member Rostelli,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Chairman Schaefer.
Yes.
Motion passes.
Okay, thank you. And you also have your monthly report. Is there anything that you would like to highlight?
Just to kind of reiterate on the COVID, because I know that's the big discussion. We are continuing our thorough testing weekly with staff and residents. We have had 5 staff members test positive. 4 of those staff members are currently back to work after their 14-day isolation, all asymptomatic. We have had no residents test positive, so we are continuing to make that very important. Staffing knows our staff knows when they come in, exactly what to do. And, so I'm very proud of them. They have really done a really good job since March, knock on wood, to keep that out of our building. So I'm very proud of them.
Thank you. Does anyone have any questions? Member Metzger.
I did notice that you had 4 admits, and then there were 34% of the ones that were declined was because we didn't have a dementia unit. And I know we had talked about a dementia unit at some point. So is that something that is really, do you at this point see that as an immediate need?
I don't know if it's an immediate need, but it certainly would help our census. I do know that just the people that I've talked to personally, they like that locked unit. They like that where they can roam as they please, and they don't have to worry about their loved one going outside and getting hurt, So it is definitely on my radar to bring up at one of our meetings. I need to, get some more information compiled for you, but yes, I do think that would definitely be a plus in the future.
And I'd like to add here too, is that the Blue Ribbon Panel has not met for several months because of COVID and because of the change in administration at the nursing home with Ms. Edens, coming in and making sure that, we've got a beginning so that we can then move forward with what we were discussing prior to COVID with the dementia unit and that kind of thing. So it has not fallen off the radar. It's very much still on that radar for the nursing home and for a potential future thing, and how to move forward with that is still being discussed. So I think that, like Ms. Eden said, that will help our census and then also will help our bottom line. But I think right now with COVID, I think people are keeping people home as long as they can before they put them into a nursing home when they actually really cannot take care of them anymore and they need that very skilled nursing care. So, and I think that Ms. Edens would probably agree with that. So that's what I've been hearing in the community. Does anyone else have any questions? Okay, thank you very much.
Thank you.
Next is County Administrator Report. And you have an item for action, Ms. Rodriguez, as a request approval of critical hire requests, which is in our packet on page 31 and 32. Do I have a motion on that? Motion by Metzger, second by Chung. Anything you want to say, Ms. Rodriguez?
I bring forth for the department heads all of their critical hire requests, as you know, and I'd be happy to answer any questions of the membership about this pretty lengthy list.
Anyone have any questions regarding this? Okay, if there are none, Ms. Morlock, I will vote. Will you please call the roll?
Yes, ma'am. Member Robistelli,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Chairman Schaefer.
Yes. Ms. Rodriguez?
Thank you, Chairman Schaefer. I do have an item D2A, our report on recent employment activities. That's on page 33 of your packet. I'd be happy also to discuss that or answer any questions the membership might have.
Any questions for the county administrator? Okay, moving on to other business and communication. We have our next meeting is on October 5th, which is our regularly scheduled first Monday. And the second item on there is a second budget meeting. And I'd like to kind of poll the members, because in the past, we've always had and it varies on which order it is, but we'd have the health department at one meeting, and then the nursing home and JDC at another meeting or some kind of combination of those. But we would usually never have the nursing home and the health department at the same meeting. So we would do the, one of them on October 5th, and the other one would then be in November for our November meetings. Or do you want to have a separate second meeting for that other one and then have our November meeting be a little bit shorter or more finalizing of things? So I'm throwing that out there for your opinions and what you want to do. Member Metzger.
I really believe that our November meeting needs to be able to get things tightened up and finished. So I'm not a fan of additional meetings, but I think it's the only way that we can ultimately get the budget accomplished by having separate meetings. And I would prefer to have a meeting, a budget discussion at our October meeting, and then have another budget discussion at another meeting within that October timeframe.
Okay, thank you. Member Gordon.
Thank you, Madam Chairman. I agree with what Member Metzger just said. And I just wanted to let the committee know, let the chair know that as things stand right now, I'm going to be out of town the week of the 12th. So if the option is between the week of the 12th and the week of the 19th, just for me, which is not the story, but for my schedule as it stands right now, the 19th, the week of the 19th would be preferable, and I would, of course, like to be present if it's possible and if it's convenient to all other members of the committee.
Okay, does anyone else have an opinion on that? So is there a consensus that we want to have 2 meetings in October then to discuss budget and then wrap everything up in November? Is that what I'm hearing or seeing or, you know, nodding and that kind of thing? Okay, I think we'll look at the October 19th then possibly for that date, Ms. Morlock.
You want me to send a doodle poll for that week? I haven't looked at calendars because there might be a couple of dates that week that would be available for staff here. Or are you wanting
Okay.
to?
And I think to add that we need to consult with Broadleaf Video as well to ensure their availability.
Correct. And also potentially other committees that have, and I know Justice, because I'm also on Justice Committee, that usually we break that up into 2 meetings in October before that November meeting. So I think that we need, Ms. Morlock, if you could send out a doodle poll and make sure we can get most of the members, if not all of the committee members on that week of the 19th, and possibly if it's on Monday, since Justice 19th is a full board meeting, I believe, so we cannot, that Tuesday is a full board meeting, so we would not be able to even have that as a possibility. And with a full board meeting, I don't know how much Monday would be a challenge for administration to prepare prior to a full board meeting. So I just want everybody to think about that with a doodle poll coming out. So Member Metzger.
Is there a reason that we couldn't use the week after our board meeting to have, I don't know if it needs to be packed in there so tightly. If we're not going to meet until November, I'm not sure why that last week, that week following the board meeting couldn't be utilized for these budget meetings.
That's a very good point, because usually I would personally take that week that we didn't have that board meeting between our board and committee meetings. That was my free vacation week to go somewhere, do things, and not doing too much of that lately. So that's a possibility too. So Ms. Morlock, I keep wanting to call you a member. Would you also include that in the doodle poll, please?
The week of the 26th?
Yes.
Thank you.
Okay. Does anyone else have any other business or communication? Member Gordon.
Thank you, Madam Chairman. I just wanted to reiterate the importance of establishing Broadleaf Video's availability in the dates. And maybe we need to sort, maybe they're the ones to start out consulting with, so we know what dates are possible in the doodle poll. And then the committee members come second.
That's a good
Thank you.
point. Good point. Thank you. Anybody else have any other business or communication? Okay. Thank you all for getting through this long meeting tonight. We have bills to pay, which have been approved, and comply with all of the McLean County Board policies and ordinance resolutions. So first up I have here is a nursing home with a prepaid total of $201,419.36. Motion by Gordon, second by Chung. Member Ms. Morlock, would you please call the roll?
Sure. Member Robistelli,
Yes.
member Gordon,
Yes.
member Went,
Yes.
member Martin,
Yes.
member Metzger,
Yes.
member Chung,
Yes.
Chairman Schaefer.
Yes. And next is jail and JDC Medical with a prepaid total of $32,639.76. Their motion? Motion by Chung, second by Robistelli. Any discussion? Ms. Morlock, please call the roll.
Member Robistelli,
Yep.
member Gordon,
Yes.
member Went,
Yes.
member Martin,
Yes.
member Metzger,
Yes.
member Chung,
Yes.
Chairman Schaefer.
Yes. Next is Developmental Disabilities Board with a prepaid total of $114,661.07. Motion by Metzger, second by Martin. Ms. Morlock, would you please call the roll?
Member Robistelli.
Yes.
Member Gordon,
Yes.
member Went,
Yes.
member Martin,
Yes.
member Metzger,
Yes.
member Chung,
Yes.
Chairman Schaefer.
Yes. And last is the Board of Health with a prepaid total of $212,954.47. Motion by Metzger, second by Chung. Ms. Morlock, would you please call the roll?
Member Robistelli.
Yeah.
Member Gordon,
Yes.
member Went,
Yes.
member Martin,
Yes.
member Metzger,
Yes.
member Chung,
Yes.
Chairman Schaefer.
Yes. Thank you. I just want to thank all of you for your input on this meeting. Everybody has a lot of different viewpoints based on what they've been hearing and who they've been talking to. And I think that that's excellent for a good dialogue to continue and move forward and try to address some of these challenging issues that we have right now. And I think we're going to have for the foreseeable future. So thank you very much. This meeting, I believe, is adjourned. Thank you.